A strong body is made up of strong bones. One of the scariest things about osteoporosis, which is characterized by low bone quality and low bone density, is that it's often silent.
Yeah, and the squad, Rheumatology Associates of Delmarva, wants to help folks get proactive about these problems. That's why they just opened an osteoporosis center in Salisbury. Delmarva Life's Katie Zerilli takes us to the office and shows off its state-of-the-art technology.
A biopsy of the bone.
A practice for those with skeletal skills. Rheumatology Associates of Delmarva was started many years ago for those dealing with debilitating diseases.
Rheumatologists are interested in diseases of the musculoskeletal system, mainly pertaining to autoimmune disorders, so rheumatoid arthritis, for instance, lupus.
Of course, when one thinks about burdens of the bones, osteoporosis might come to mind.
Osteoporosis itself is a disease that is characterized by low bone quality and low bone density that increases fracture risk.
However, according to Dr. Curtis Foy, osteoporosis is not a rheumatological disease. It does, though, fall under the scope because sometimes medications to control rheumatological diseases can aggravate bone loss and cause osteoporosis. That's why last year they opened this osteoporosis center right here in Salisbury.
We just kind of felt it was important to establish an osteoporosis center here where we can be available to the public and available to primary care physicians and other physicians in the area who have patients that have osteoporosis who want to get an opinion on what the best path forward is for them.
Dr. Foy says osteoporosis is often silent and symptomless unless one fractures a bone. He says those who are low in calcium and vitamin D are at a higher risk, and other factors that come into play are amount of exercise, whether or not one smokes, and alcohol intake.
We want to really focus on being sure that we address the lifestyle measures, and in some instances we may need medications to lower somebody's fracture risk as well.
This facility is also fit with technology to track down problems, too. This bone density scanner is a top tool for early intervention.
There's a database where we compare bone mineral densities of whoever we scan to a kind of a normal population, right? And so there's a thing called a T-score. And that T-score is a value that gives you an idea of how many standard deviations from the normal is your bone density. And then that gives us more information as to whether do we have osteoporosis, do we have low bone density.
With this tool, they can also make patients aware of what's called their trabecular bone score.
Gives you an idea of what the microarchitecture is of the bone. You can see people that have low bone density but really good bone quality, and vice versa. You can see people with low bone density and then have terrible bone quality. And sometimes that additional trabecular bone score information might sort of push us one way or another as to whether or not we're going to treat or not. And then the other thing we do here is we do something called a vertebral fracture assessment, where we lay the patient on their side and we scan the spine looking for compression fractures. And compression fractures happen when there's weakness in the bone, the vertebrae. And what happens is the vertebrae literally can collapse. And a lot of patients that have these don't even know they have them. It's important to identify them because once you've had a vertebral fracture in your spine, then it sort of sets the stage for other ones. And so one vertebral compression fracture increases your risk about 3 to 4-fold to have a second one. If you have 2 of them, your fracture risk is about 25-fold.
These low radiation scans won't take more than 15 minutes and aren't the least bit claustrophobic. As far as who should get screened, Dr. Foy says women above 65 and men above 70.
Anybody that's had a fracture history that's suspect.
For this doc who has a history in primary care, he loves to help folks not only grow stronger bones, but live healthier lives.
I've convinced a couple people to actually quit smoking on the basis of their bone density. So that's huge.
The office here in Salisbury can assist others too. Check out this infusion center.
The patients that have Crohn's disease or ulcerative colitis sometimes are on infusible medications that are prescribed by their gastroenterology physician, and we're available to do those infusions here for patients and for those providers if they wish.
Dr. Foy says when it comes to osteoporosis, there are 2 types. Primary, often due to factors like family history, and secondary, caused by a medical problem like celiac disease. He says no matter which type, osteoporosis is something patients will likely manage for the rest of their lives. The good news is, he's here to help along the way.
It is nice to have people come back after their, maybe first year or 2 years on therapy, get a bone mineral density test, follow up with them, say, hey, how you doing? Hey, did you ever quit smoking? We talked about that. Hey, how's your exercise going? And they're like, well, I'm getting out more and I'm walking more and doing some more things. And that's a good feeling.
A good feeling. No bones about it.
Rheumatology Associates of Delmarva is also located in Cambridge and Easton.
So they're close.
They are.
They're close.